Imagine for a second that you're a CEO. You run a huge company, you have investors, a board, and a massive budget.
Mm-hmm.
Now imagine you take $24 billion of that budget. You just shovel it out the door.
Yeah.
And 3 years later, you tell your shareholders, I actually don't know what we bought. I stopped checking the receipts back in 2021.
Oh, wow.
Oh, and by the way, our customer list, it includes Mickey Mouse and Superwoman.
I think the fraud investigation would start before you even finished that sentence.
Exactly. You'd be fired, sued, probably indicted. But here's the thing. This isn't some hypothetical business school problem.
No, it's...
This is the actual documented reality of how the state of California has handled its homelessness crisis for the last 5 years.
It sounds like an exaggeration, but it really isn't. We're looking at a stack of reports today, specifically this massive state audit from April 2024. And it paints a picture of a system that is, functionally blind.
Burning through a mountain of cash with zero accountability.
Pretty much.
And that's really the mission for this deep dive. We're not just looking at the tragedy on the streets. We all see the tents, the suffering. We're trying to look at the machinery behind it, the bureaucracy. We have to ask the question, where did the money go?
Because that headline number is just staggering.
It is. The audit covers the last 5 fiscal years. And in that time, California spent $24 billion.
$24 billion with a B.
I just want to pause on that number. It's so big it almost means nothing. It's larger than the entire economy of some countries.
Yeah.
You could, theoretically, build a small city from scratch with that kind of money.
Right. And you'd expect, with that level of investment, to see, real change. Cleaner streets, fewer encampments, more people getting help.
But that's not what you see.
Not if you walk through parts of LA or San Francisco. The visual evidence, it suggests the problem is getting worse, not better.
So you have this huge disconnect. Record spending, but what looks like record failure. And that brings us to the real news hook here, from the state auditor himself.
This is a smoking gun. The report basically says the state has just stopped tracking whether any of this money actually works.
Got tracking.
Yeah. The main agency, the California Interagency Council on Homelessness, they're supposed to be the quarterback for this whole thing. The audit found they haven't comprehensively analyzed their spending data since 2021.
Hold on. Let's be clear. They didn't stop spending money in 2021.
Oh, no, the spending continued.
They just stopped checking if it was doing any good.
Precisely. They're flying completely blind. And when the auditors finally got into the data that does exist, it was a total mess. And that's where those names you mentioned at the top come from.
The Mickey Mouse scandal.
It sounds funny, but it's really not. It points to a complete breakdown of data hygiene. The state's main database, the one tracking who gets services, it literally lists recipients with names like Mickey Mouse, Superwoman, and test participant.
Okay, so devil's advocate here. Is that just a few IT guys running tests? Or is this actual fraud?
Even if it's just testing, it pollutes the whole data set. How can legislators make good decisions with that? But it points to a much deeper problem. If you have an entry for Superwoman, how can you possibly know how many real people you helped?
You can't.
You can't. And it's an insult to taxpayers.
Hi.
Billions of dollars. And the bookkeeping is at the level of a middle school science project.
It sounds like what one state senator called a data desert.
I want to dig into that because it's not just bad data. It suggests a total absence of it.
That's a good way to put it. It comes down to a total lack of tracking outcomes. The audit looked at 5 major state programs. For 3 of them, there was literally no data to determine if they were effective.
None.
0.
And when you say effective, what does that mean? Are we talking about did they get a meal or did they actually get off the street for good?
We're talking about the big one. Long-term housing. Did the program actually solve the problem for a person? Take the main program, HHHAP. It's the Homeless Housing Assistance and Prevention Program.
That's the big bucket of money, right? That's the big one. The auditor found that nearly 1/3 of the people who leave that program, their destination is listed as unknown.
Unknown. So we pay for them to be in the program, staff gets paid, resources are used, and then they walk out the door, and we have no idea if they got an apartment or went straight back to a tent.
No clue. A 33% failure rate in just knowing where people went. It's a massive blind spot. And yet, despite that, the state authorized billions in additional funding for that exact same program.
That is the definition of failing upward. It seems like the only metric for success in Sacramento is, did we spend all the money?
That really seems to be the operational model. And this isn't just a state-level problem. This incompetence, it just trickles right down to the cities who get the cash. The audit looked at San Diego and San Jose, and wow.
So let's talk about San Diego. What happened there?
In San Diego, the city signed a contract for a shelter, $1.6 million. Now, any normal government contract has deliverables. You give us X money, we serve Y people. But this contract didn't even specify how many people should be served.
It was a blank check. Here's $1.6 million. Just do your best.
Pretty much. No headcount, no metrics. How do you hold a vendor accountable if the contract doesn't say what they're supposed to do? You can't.
And what about San Jose? I read something about inflated data.
San Jose is maybe even worse because it feels less like incompetence and more like, well, deception.
Yeah.
They extended an $8 million contract based on performance data that the auditors called vastly inflated.
Inflated how?
Get this. There was one case where a shelter claimed to have nearly 1,100 people enrolled,
Okay.
but the facility, it only has 300 beds.
That's physically impossible.
Yeah.
You can't fit 1,100 people in 300 beds.
Exactly. It's what we call the phantom bed phenomenon. You're paying for capacity that doesn't exist or for service numbers that are just fiction, and the money just kept flowing.
This all paints a picture of a system that's just allergic to being watched.
Mm.
But let's pivot to what was supposed to be the big fix. Governor Newsom's signature project, Care Court.
Right. The Community Assistance, Recovery, and Empowerment Act.
It was sold as a new paradigm.
Yeah.
For the people on the streets who are so severely mentally ill, they can't make decisions for themselves. This was supposed to be the tool with teeth to get them into treatment.
It was the answer to that cry of, we can't just leave them there to die. It launched with so much fanfare, but the performance, the gap between promise and reality is just devastating.
Let's do the numbers. How much did the state put into this?
Since March of 2022, the state has spent $236 million just on Care Court implementation.
$236 million. And the projection was, how many people was this supposed to help?
The administration estimated that between 7,000 and 12,000 people would qualify.
Okay, so 12,000 people. If you took the 12,000 most severe cases off the streets of California, that would be a transformation. You'd see it overnight.
You absolutely would.
So what's the real number? How many people have actually been court-ordered into treatment through this program?
This is the number that just stops you in your tracks. As of the last report, 22.
I'm sorry, did you say 22 like 2-2?
22 people.
I'm trying to do the math here. $236 million divided by 22 people that's over $10 million per person.
It's astronomically inefficient. Now, the state will argue that we're missing the voluntary agreements, people who agree to treatment without a final court order.
Wait a minute. The whole point of Care Court was the court part. We already have voluntary programs. This was for the people who refuse voluntary help.
Mm-hmm.
If it's just getting voluntary agreements, isn't it just an expensive new layer of bureaucracy?
That is the number one criticism. It's bureaucratic bloat. The courts are dismissing huge numbers of petitions. In San Francisco, something like 2/3 of the petitions filed were just thrown out.
Thrown out.
And in Los Angeles, which had the most petitions, there were 0 graduations from the program in the initial period.
0. That is just heartbreaking for the families who were counting on this.
It is. We read reports from mothers like Rhonda DePlace's, whose son has schizophrenia. She thought Care Court would be the lifeline. Now she calls it a revenue-generating system for administrators.
A revenue-generating system? What does she mean by that?
Well, look at it from her perspective. You go to court, you see judges, lawyers, county staff, all of them drawing 6-figure salaries. The meetings happen, the money gets spent, but the actual bed for her son, it's not there.
So the money gets absorbed by the machine before it ever reaches the person who needs it.
That's the feeling on the ground. And yet, facing this data desert, this Care Court failure, the state's solution wasn't to pause and fix things. It was to ask the voters for even more money.
Which brings us to Proposition 1. It just passed in March. I think a lot of voters thought, well, we have to do something, but what did we actually vote for?
We voted for a lot more debt. Prop 1 authorizes a new $6.38 billion bond, billions more borrowed against future taxes.
And does it fix any of the management problems we've been talking about?
It actually shifts more power to the state. It restructures the millionaire's tax, moving control away from local counties and centralizing it more in Sacramento.
Let me get this straight. The same state government, the one that lost track of $24 billion, that has Mickey Mouse in its database, whose main counsel hasn't checked its work since 2021, now wants more control.
That's the reality. The argument from proponents was that the counties were failing, so the state needed to take over. But given the state's track record, it's a very hard argument to believe.
So why do they say they need another $6 billion?
It's the funding gap argument. There's a RAND report they point to that claims the state needs an additional $9 billion a year to actually meet the need.
$9 billion more every single year.
Yes. The logic is that real evidence-based care is expensive. The report says it costs about $21,000 per person per year to do it right. But the current system only spends about $5,000 or $6,000.
Okay, but even if it costs $21,000, are we sure we'd get 4 times the results? Or will we just be funding 4 times the waste?
That is the $24 billion question, isn't it? The argument from Sacramento is always, we're under-resourced. It's never, we're mismanaged.
And that leads to a really dark possibility. Is this just incompetence? Or is there something structural happening? Is the system built this way on purpose?
This is where we have to talk about systemic fraud. The former DA of Los Angeles, Steve Cooley, was very blunt. He said fraud is inherent in these programs.
Inherent. That means it's a feature, not a bug.
Right. He argues the agencies don't build in ways to prevent fraud. Their job, as they see it, is just to get the money out the door. They're judged on distributing grants, not on protecting the taxpayer.
So the goal becomes spending, not actually fixing the problem.
Exactly. And now you have a new federal waiver, BH Connect, promising billions more in Medicaid money for incentive payments and workforce initiatives.
Workforce initiatives. That sounds like hiring more administrators to me.
It creates a huge risk. You have to be honest about the incentives. You are building a permanent class of government-funded groups whose entire livelihood depends on the crisis continuing.
That's a perverse incentive. If homelessness is solved, their funding dries up, their jobs go away. So the system is designed to sustain itself, not to solve the problem.
It's what some call the homeless industrial complex. And all the while, people are still dying on the streets.
It's a tragedy on every level. Let's try to recap this because the numbers are just dizzying.
It's a laundry list of failure. First, we tracked $24 billion into a data desert. The state just stopped checking the results in 2021.
Second, we found out the database is so broken it lists Mickey Mouse and Superwoman as people getting help.
Third, we saw $236 million go into care court to produce a grand total of 22 court orders.
And finally, after all that, the voters approved another $6 billion in debt, handing more power to the very people who oversaw the mess.
That about sums it up.
The takeaway for me is clear. The problem in California isn't a lack of compassion. It's not a lack of money. $24 billion is enough to do incredible things if it's managed properly.
The issue is a total lack of adult supervision in the state capitol. It's a lack of basic accounting.
Here's a final thought for you to chew on. If a private company lost billions of dollars, couldn't tell you where a third of its inventory went, and listed its customers as Superwoman,
Yeah.
the CEO wouldn't just be fired.
No, they'd be in handcuffs.
They would be indicted for fraud. So why do we accept this from our government? And maybe more importantly, why do we keep writing them another check? That's the question we all need to ask.
Couldn't agree more.
Thanks for listening to The Deep Dive. We'll catch you next time.